If you've had one stroke, your risk of having a second stroke is about 25%. So it's imperative that we take care of the stroke risks first time so you don't have a recurrence. It's imperative that we take care of all the modifiable risk factors for strokes. It's important for people not to smoke because smoking can increase the risk of strokes. Smoking causes less oxygen, so when you have less oxygen to your lungs, you'll have less oxygen to your brain. Medications fall into several different categories. So one of the categories for taking medication is to control your blood pressure. If you have high cholesterol, so you have to take medications for high cholesterol. Third, if you're diabetic, if you have glucose tolerance, so you need to be on your glucose-lowering medication because we know that diabetes can increase your risk of strokes. Taking medications and monitoring medication with your doctor is a very important thing to do.
If you have sleep apnea, it's also important to stick to your treatment plan to reduce your risk of stroke.
Don't live a sedentary life. Start exercising. My recommendation is to start exercising 30 minutes a day, every day. Even taking a walk, a stroll in the evening for 30 minutes is good. And if you haven't been doing it, get into a habit. And I recommend it for people who've not had a stroke because it's that important. In terms of diet, we know high cholesterol, high fatty acid diet is detrimental to having a recurrence of a stroke. Please see a dietitian and see what they would recommend. Changing your diet, changing your lifestyle is quite important to prevent recurrence of a stroke, and strokes are devastating. Once somebody's had a stroke, what I recommend is to develop a plan. And the plan includes self, family, and professionals. And it starts with the self. But then you also employ your professionals, your doctors, your physical therapist, your occupational therapist, your speech therapist. These are the professionals that'll help you get back to normal and prevent another stroke. When somebody's had a stroke, the first thing they lose is their confidence. So once we get your confidence under control, that yes, you will get better, and once that happens, then the prevention of secondary stroke happens. But you cannot lose your confidence. Confidence is very important.